Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. You can make use of it. My dear friends, in the last class we are talking about the functional integrity of the body, and also we have been talking about science and art, whether medical science is a science, pure science, or is it a art. So we have been discussing on that factor. At the end we concluded that medical science should be a amalgamation or mixing of both science and as well as art. Then only it will have some benefit to the patients. Now we will continue the same. I will give an example. For example, when a teacher teaches the class of 30 students, suppose. So suppose you take a teacher is teaching a class which contains almost 30 students, and he is teaching the class in a similar way. Okay. What actually happens at the end of the year or at the end of the day, one student may excel with a very good performance and other student may fail. Now the question comes, who is responsible for this? One student is performing very well and another student is performing very badly. And now whose fault is this? Now if you look into very carefully, this is not the fault of the student and it is also not the fault of the teacher. Nobody can blame the teacher that he is responsible for that one failure student, because other student was getting a very good result, other student was excelling, he is doing the excellent performance. So this is the case. You cannot blame the teacher and you cannot even blame the student also. You cannot blame the student because another student was very good in learning, in catching, recalling, gaining, etc. Other student was not actually so intelligent, so smart, therefore he failed to understand. A similar thing also exists in the medical science. Suppose I have given one medicine for 100 patients. I have given a medicine for 100 patients, and if you are not come up with the desired outcome, and if you are coming with a very good outcome, now who is responsible for this? Out of 100 patients, suppose 10 patients are come out with a very good response to my treatment. I have given the same treatment and the disease condition is also same, and for about 50 patients it was not giving any result at all. So can you blame the doctor? Actually you cannot blame the doctor if you take the above example of teacher and student. It's a similar situation, but unfortunately a doctor was blamed for that, isn't it? A doctor was blamed for that, or doctor was made victimized if the 50 patients are not getting the results. Actually it is not the case. So therefore we are repeatedly, I am telling, medical science is a science of uncertainty, but there is a art of probability. There is a art of probability. So, but even then we can succeed. But even then we can succeed. For that we have to merge the science with the art. Okay, there is a probability, art of probability. We don't know that 50 patients who are not getting the result, if you have tackled them with some art, okay, which is a art of probability, which is a chance of probability, then they might have been also shown some good results. We have merely given the medicine. Merely given the medicine, and therefore they have not given the desired effects. But if you merge the art also while giving the medicine by means of care, compassion, sympathy, empathy, etc., so then who knows, they might have been come out with a good result. Similar to the example of student and teacher, yes, one student has totally failed, but who knows, if you have given some extra effort on that, if you try to explain the same concept in a different way, he might have been gained that knowledge and he may be also coming with the good results, might have been come up with a good result. That possibility is there. Therefore I am telling, medical science is not merely a science, and there should be a mixing of the art also. Science and art both should be get mixed in our practice, then only we can get the success. Now what is art? To have some discussion, art is one which treat the mind. Now we are coming to our topic of holistic approach. Okay, so art is one which actually treat your mind, and science is the one which treat your body. That means science is the one which gives the knowledge to you. Okay, whereas art is one which actually treat your mind also, which also stabilize, stimulate, or what do you say, modulate your mind also. This art has many other issues to discuss. Okay, now coming back to William Osler, he said that use the art of probability. Now that is always think what is most probable. You have to think always most probable. If it is not so, then think which is less probable. And if it is only after that, you have to think about the impossible. So what Osler says, William Osler says that there is nothing like that impossible. There is also probability. Okay, so first you have to try which is most commonly seen, then less common, then only you have to think that it is impossible. Don't say the patient this disease is impossible to treat. No, start with the probability. Okay, then start with the less probability. Then if everything fails, then only you can come to a conclusion that yes, I cannot treat this. Okay, by looking at the gravity of the disease, don't decide that I cannot treat it. Because art, when combined with the science, may make some miracles. After trying all the things, then also if it is not possible with the desired effects it's coming up, then only you decide yes, now it's impossible to treat this condition. This is what he is telling. Now again, in the medical field, we have the art of clinical bedside medicine, isn't it? Clinical bedside medicine in the medical field we have. Unfortunately, the bedside clinical medicine is nowadays disappearing. Everybody is depending upon the diagnosis based on the investigation, not diagnosis based on the clinical examination. That is the most unfortunate thing which is happening in the medical field. Okay, everybody will now prefer to go for investigation, and through investigation they try to diagnose. But previously it is not like that. Through clinical examination we used to diagnose the things, then by the investigation we used to confirm the thing. Now there is no clinical examination at all. Directly we are confirming the things through the investigations, which is not at all a good practice. Not at all a good practice. Again, investigations give a particular biochemical value which may not be true in every patient. I have given the example, a patient with the investigation may be showing that patient has got the liver problem, but patient may not have any liver failure symptoms. So it's not hard and fast rule that investigation values of each and every patient is always similar, isn't it? So even our BP, we are taking the average, isn't it, 120 by 80, but it may not be true always, because it is the average of so many BPs taken in crores of patients. Then we put a statistic value and then a statistical value, and then we took the average, and now it is 120 by 80 is considered as the normal BP. But a patient may be there with the 140 by 90 having a very normal life, isn't it? So this statistical value based parameters may not be true in Ayurveda, because Ayurveda very clearly say Purusham Viksha. Every patient is different, and now we are moving towards the personalized or individualized medications also. So this is a very unfortunate thing which is happening. Anyway, we are all humans, therefore we have to behave humanly. That's one more important thing. We are coming to the art part. Okay, medicine is a science or art. We're discussing about the art. Three things are very important for any physicians. Number one is sympathy, empathy, and compassion. I think many of you may be knowing the difference. What do you mean by sympathy? In the art, this part comes under the art. Art means dealing with the patient, healing of the patient, reassuring the patient, consoling the patient, and touching the patient's heart. Okay, so that's all art. Okay, so patient should have a feeling that yes, this doctor is seriously trying something to treat me or to give some better results. Now, what is sympathy? Sympathy is at the spinal level, usually we say, very superficially. Somebody is in pain, we are showing our concern, yes, okay, you are pain, okay, it's very bad, it's very bad. So, this is showing our concern coming only from the superficial level. Okay, so maybe at the spinal level. So, then it is called as sympathy. But what is empathy? Empathy is something different. It is from the cortical level. That means your thought process is coming. Okay, your higher mental functions are coming there. So you are telling that okay, you have got the pain. I know that what may be the intensity of the pain. Even I too experienced that pain. Definitely, it is bad. Now you are having some touch there. In the first case, only sympathy from the spinal cord level, superficially, and empathy. You are using your brain also, thought process. Your higher mental functions are also coming. So this is called as empathy. But when you come to compassion, compassion is different. What is compassion? It is more than that. So you are coming directly from the Atma level. Okay, so Atma level, that is what is the okay, you have got the pain, and I know the severity of this particular pain. I can feel it, and in compassion, what comes next part? So I will try to help you. I know how to heal it. I know your pain. I have experienced experienced that. I know how much you are suffering, and I will try to heal it, and I will heal it. So this comes compassion. Okay, so sympathy, empathy, and compassion, all the three should be there with us when we are dealing with the patients. This is the message, and this is again the holistic approach. Simply giving some medicine is simply not a holistic approach at all. It is simply giving the medications, the disease management. That's all. But this is actually holistic approach in the treatment. So along with this, we must know show some of the. We should also know the medical ethics also. Simply giving the medicine is not good, isn't it? May have adverse effects. So there are some medical ethics is also there. So that should be in our mind. That is also comes under the holistic approach part. Okay. So we know that is they are 4 in number usually, medical ethics. Maybe everybody is knowing that: beneficence, non-maleficence, and privacy and justice, isn't it? So whatever medicine we are giving, it should not harm the patient. It should give the benefits. Patient's privacy or autonomy should not be interfered, and it should be justified. So these are the 4 important things which comes under the medical ethics. That's a different issue. But medicine and art. Medicine is a science and as well as art. So this sympathy, empathy, and compassion, these are the part of holistic approach. Okay, so which was totally embedded in Ayurveda practice. So Maitri Karunya Bhaveshu Aturasya Antaratmana. So very clearly says, Charaka very clearly says that when you treat the patient, you should try to touch the Antaratma of the patient. It's not like superficially giving the medicine. Try to touch the Antaratma of the patient, be near to the patient, try to feel his suffering and try to treat it. Aturasya Antaratma, you should touch his Antaratma. Okay, Putravat Paripale, that means you have to treat him as family member. Patient should be treated as your family member. So this is called as holistic approach. This is the holistic approach of Ayurveda. So this is a reference if you want. Maitri Karunya Matreshu Shakti Pratirupakshanam. Okay. So Vaidhyavrittir Chaturvideti Charaka Sutrasana. So very Prakatisteshu Bhuteshu. So these things are very important in practice. In the next part again we will have the continued approach of this holistic approach. So for today it is almost sufficient. Tomorrow onwards again we will continue the same. Thank you very much.